Oh, I'm happy we got a micro question. Okay, so which of the following is the most causative organism in this patient? A 65-year-old woman with a history of, man, sorry, the history of IV drug use presents to the emergency department with fever, dyspnea, and chest pain. On examination, the patient's blood pressure is low, and diastolic murmurs heard best on the upper left sternum border, and then so large vegetation on the aortic valve, and admitted to the intensive care unit and then started on therapy. So usually with like this, it's Staph aureus. However, I'm a little bit skeptical just because of the aortic valve, but I'm gonna keep it at that because
Okay.
nothing else makes sense here.
Good. Yeah, staph, right? Usually for the most part it's going to be your tricuspid
Okay.
valve usually, but it can vegetate in other valves too. But yeah, for sure, staph is going to be your most likely. If you think about it, right? I mean, back in the day, right, when I was studying for step, I used to just memorize this fact, but actually it makes sense. Why do you think staph is going to be your like? How do people that use IV drugs get staph in their heart?
It's because so Staph is your normal skin flora.
Yeah, yeah.
Correct.
Exactly, right? I didn't connect it back in the day. Obviously, when I started tutoring, right, I would explain this, right? It makes sense, right? Normal skin flora, right? You're poking, either dirty needles into your arm, and then that seeds into your blood, and then your blood gets then, circulated through, and then some of those staph aureus organisms then get stuck on your valves. So you can get like endocarditis and things like that, right?
Yeah.